Hello and welcome. This is the Baker Senior Show. Today we're going to be talking about detailed differences between the Medicare supplements and the Advantage plans. I understand that the Medicare supplements are called Medigap. Hi, Steve.
Hi. Hello.
How's it going?
Great. Glad
Good.
to be
I
with
know
you
you're
today.
out there helping people try to just figure out all the Medicare information, which,
Mhm.
I've known you for a long time. We've dealt with Medicare with clients and my personal friends. I still have a lot of questions. Thank
Okay.
goodness you're there to answer them.
Right. Right.
So let's get started talking a little bit about some back things that we've talked about before. Right now, we're getting ready to go into like a system, right? A program where people can decide what they're going to do with their Medicare, and it's
Hmm.
all considered insurance, correct?
Correct.
Sorry, somebody from Dallas is calling me.
Oh,
So Medicare is considered insurance, and I think if you're like me and you're just getting into the fact that Medicare is coming up soon for me,
mhm.
I have about 3 years that I didn't
Right.
really know what Medicare was. I'd heard of Medicare, I've heard of something else, Medicaid, but I didn't know
Hmm.
the difference, and I didn't know really that it was health insurance.
Correct.
I don't know what I thought it was, Steve,
Hmm.
but I think until you're it's getting close to time that you start really thinking about it.
Hmm.
It's like retirement. Oh, that's a long way away. I don't need to think about it until it's like getting closer, and then you're like, oh, I guess I better think about my retirement.
Exactly. Exactly.
So if you're a newbie like me, what is the first thing that you would tell somebody that's thinking about what they're going to do when they retire or what they're going to do when they turn 65?
Hmm. Well, one thing that I've emphasized over and over again that there are two kinds of Medicare, and there's the traditional Medicare, which is the A and B, and you can basically sign up, and either way, whether you go with the Medicare, traditional Medicare, or if you go with a Medicare Advantage plan, it's both the same. There's something that's called a Part B, and I want to tell you that the A part you've paid for through the years. However, when you sign up for Medicare, when you turn 65, or in certain situations and circumstances, and it has to be done just right, you can wait to take your Part B until it's necessary. But once you take your Part B, you've got to realize that there's a monthly premium that must be paid. This year, it's 169 for the monthly premium for Part B, and most of the time, well over 90% of the time, that can be deducted out of your Social Security check. And therefore, people don't realize that they're paying it, but they are paying it because it's deducted out of your Social Security check. That's your monthly premium for B.
So when you first start Medicare, you are enrolled in the A, and then you only take Part B when you're ready. And when you're ready, you start paying
Correct.
$169.
Yes, and the Part B premium changes from year to year; it goes up a little bit. So now, also, you've got to realize that there's also a premium, one time deduct, not a premium, but a deductible, one time deductible of 198 that you got to have. Now that's all well and good, but you've got to understand, if you just leave it like that, Medicare pays 80% of your medical cost, and the other 20% is up to you to pay. So let's say you go to the doctor or you have some medical issue, um, Medicare will pay $800 and you will pay $200 out of your pocket. So in order to minimize uh, your outlay, your monthly outlay, or your immediate outlay, you typically will go to a supplement. It's not necessary, it's not mandatory, but in order to keep from having to pay large amounts of money, you can get a supplement on that side. You don't have to, as I say. On the other side is the Advantage plans, and typically, as you'll see over and over and over and over again, from October 15th through December 7th, there's zero premium. They say zero premium, zero cost. That is, well, they say zero cost, and then everyone thinks, oh, it's free. It's free. No, it's not free. So there are other issues that come involved, but you really need to be educated. And what I'm talking about this morning is to be very careful when you make the decision of which way you go, because there's pluses and minuses to each one. On the traditional Medicare side, as I say, you've got 20%. And in order to make that 20% disappear, you get a supplement plan, Medicare supplement or Medigap. They're interchangeable. And you've got to realize that that there's a premium for your Medigap plan, and people think, well, that'll just be the same and it goes up over the years. It goes up. So it's a gamble. It's really just a straight out and out gamble. If you're healthy, does that mean you're going to stay healthy? No, it doesn't mean you're going to stay healthy. So you've got to decide. And what you need is you need someone like myself to sit down with you and go over. I've been on Medicare for quite some time, so I can explain my situation. And also I've got hundreds of clients that I have, and I can explain some of their situations. So I could pull examples out of my clients and show you what has happened with them and where they are, and a few disasters along the way with some people. So you want to avoid disasters at all costs.
Oh, yes, absolutely.
Right.
I don't wear flip-flops in the mud anymore.
That's good.
That's how I broke my arm, by the way.
Oh, really?
Woo! Oops. That was a disaster for me.
Yeah, exactly.
So, Steve, you told us many times that they could get a free copy of the Medicare and You book, and I have your phone number listed here, 832-754-3292.
Uh-huh.
And I know that we're getting ready to come up to a place that's the annual enrollment. Is that now the 2021 book, or are they still working on the 2020 book?
Well, it'll soon be ready. The 2021 book will be out soon.
Okay, so you should put that phone number right up on your refrigerator and let Steve know that you're getting ready to need that book. Because as we go over all these different options for Medicare, you might have some more questions. If Steve goes over some details and you want to go over it with your wife or your husband or your family, then you can open up the book and see. I have a copy of the book. It's pretty large.
Right.
Goes into everything Medicare.
Uh-huh.
Wow, see?
Exactly.
You just might need that book. So be sure and let Steve know that you're considering going on Medicare. Well, not considering, you're getting close to 65. It's not an option, is it?
Mm-hmm.
You're signed up.
It's not an option.
It's part of being an American. You will get on Medicare.
Exactly.
So you might as well get the book.
So what happens is that you actually have a fork in the road. Left fork or right fork? Which one do you want to take? And if you're confused about that, as I say, you need to speak with someone like myself who can guide you and ask some questions about your particular situation. And then I can make a recommendation on which fork you should take. And I can warn you about certain pitfalls on either way. So there are certain pitfalls that you need to be aware of. a lot of it has to do with your health, and most of it has to do with your finances. So I can ask some questions and say, well, it looks to me like you probably need to go the Advantage route, and I'll explain the benefits of doing that over a long period of time. And then on the other side, well, you looks to me like you can comfortably handle a supplement, traditional Medicare with a supplement, and then I can guide you there. And I can give you examples of both areas, and then you decide. So and any professional who's been doing Medicare for any length of time will be able to do that, because it is complicated. And a lot of times it creates a paradox about one or the other. So, for example, a good friend of mine, Chris Westfall, has a lot of posts out about Medicare, and he was talking the other day about a survey that he ran across from eHealth, and 63% of retirees preferred the traditional Medicare with the supplement, and only whatever else is 37% or so actually preferred the Advantage plan.
Why is
So,
that, Steve? Do you know? Is there a
well, it's experience.
okay? So the Advantage plan's not for everybody, is what you're saying.
Exactly.
So those two things are really quite plain to me now that we've been talking about Medicare for a while. You can have traditional Medicare with a supplement, which is an insurance, right? Or
Mm-hmm.
you can go with the Advantage plan, which is supposed to have that supplement involved inside it, right? That's
Right.
kind of what I get. Okay.
Right.
And so people that have done both have
Mm-hmm.
voted, and they're voting for most people like the one where there's traditional Medicare with a supplement.
Right.
And
Yes.
that's the one that's called a Medigap.
Yes. Exactly. Medigap,
See?
supplement,
I'm
exactly the
finally
same thing.
understanding, Steve. You finally got through to me.
Exactly the same thing. So I'm able to ask the questions and then make a recommendation. I can't say that it doesn't matter to me, because I do them both. I have Advantage plans and I have the supplement. I can tell you what I've done for myself and use me as an example, and I can use many of my clients as an example. But we don't know what's coming down the road, and that's the big issue there. If you're in open enrollment, you've got a period of time. You've got but you have 1 year to decide without revealing your any health questions. So if you have a major disorder or some sort, chronic condition of any sort, chronic health condition of any sort, then the traditional Medicare might be the way to go. And then if you don't, then you just kind of take your chances and move down the road with it. But only once people reach about age 70, then they start appreciating the fact that they've gone the traditional route from 70 to age up to 70, 79, or even beyond 79. They've had experiences. They've had their appendix out. They've had this wrong, that wrong. They've been in the hospital a couple of times. They felt like you talk about, you fall and break your shoulder.
Yeah.
And then the Advantage plan goes, okay, you've got that. So you're going, okay, how much is this going to cost me? All of a sudden, you realize that you're going to have to pay quite a bit of money. If you've got traditional, you've got to pay next to nothing when you go to the emergency room, or if you're checked into the hospital or whatever. So you really need to be educated, and that's what I'm about, educating you about the pluses and the minuses of either side. So if someone decides to go to the to the Advantage side, okay. Next step, we've got to check your doctors and see if
Why
your
do they
doctors.
call it Advantage, Steve? What is somebody must have thought it was an advantage over the traditional Medicare with a supplement.
Mm-hmm.
Were they just wrong?
Well, I'm not going to say.
I know, I know.
I'm
But,
not going to say because
somebody came up with that.
a lot of people. I'm not going to downplay that because a lot of people have no choice, depending on their financial situation. If their household income would support traditional side, yeah, that's the way you need to go. But then you need to be warned about yearly increases that occur on a 100% time. Those ones you start with won't stay the same. They'll move up. And I can tell you examples for myself and my wife and what it's done. And I told you some while back I had an occasion to go to the emergency room, and so I just gave them my card, and I didn't have any issues, didn't any thoughts about what it was going to cost because it was all paid for. But on the other side, if you've got issues with household income, then we really need to talk about that. And whoever you talk with, whether it be me or anyone or any Medicare professional, you need to give serious thought to either side. So that's that's the issue. And most of the people, when they reach 70, they've had some experience. They've gone to the doctor. They've had something that they've had to pay for. I think they had to pay for with on the traditional side. And I had a person tell me the other day that they're so thankful that they made the right choice, because they've had friends on the Advantage side, and it's a nightmare to because the doctors, just because your doctor's in there, I'll just go ahead and say this, just because your doctor's in there, if for some reason during the next year you can't change, only on the AEP, annual enrollment period, you can change. However, if your doctor decides to drop out of your plan, then you're stuck. You've got to go find another doctor. So that's a huge, and I always point that out. That's a huge issue. Now, if you're willing to live with that, and if your financial circumstances dictate that you must live with that, then that's the way we go. If not, then we can go the other route. So whoever you work with, whenever you make, the decision, you need to carefully make an allowance for it one way or the other. In this time of year, coming up in October, your telephones will explode. It's going to happen. When you turn 65, your telephone will explode. So you ring, and it's total confusion. So watch shows like this and make a decision. And even though I provide people with the coverage they need, I'm not a salesman. Like when you walk on, have you ever had the experience of walking on a used car lot?
I don't get out of the car anymore. I just drive around because I can't stand it. They come, it's like, beeline to you.
Right,
It's like,
exactly.
ooh,
Exactly.
yeah, no.
So they all come out running to you and so forth. And that's not a situation you want to be in.
No, I don't care for that situation.
You want to start early and be educated and balance it out and make sure that you've made the right decision. And someone like me can say, okay, this is, in my opinion, this is the route you should take.
So let's talk a little bit about the annual enrollment period that's coming up between October 15th and December 7th. There's certain things that have to happen during that time, but can't they call you ahead of time to say,
yeah, sure.
I know it's coming up. Let's get let's get it all straightened out before October 15th.
Sure, exactly. Oh yeah, you can start as we're speaking. It's early days in September, so you've got all that period of time to speak with someone like me, and I can advise you about what I've had and what my wife has, what I have, so that I can tell you what my experience has been. And then I've got clients on the Advantage side as well, and so I can tell you what their experience has been. But it's just the way it is. My mother always said I'm just like a darned old used car. As she got older, one thing breaks down, and then another thing breaks down, and then another thing breaks down. So when you get older, and by older I mean in your 70s and even into your 80s and so forth, you need to actually understand that you've made the right choice.
Oh, absolutely. And, we've talked about this before, but if this is the first time someone is watching your show, I want you to know that Steve wants to talk to you. That's why his phone number is on the screen right here,
Right.
832-754-3292. And this could be that you're calling for yourself, you're calling for your spouse, you're calling for a neighbor or a coworker. A lot of times people don't care until it's an emergency, and that's okay. You're willing to take emergency phone calls as well. And
Uh-huh.
one of the emergencies that I'm thinking about right now is you went into work today thinking that you had a job, and guess what? They laid you off. Now what do? You don't,
Exactly.
do you stay with Cobra insurance, or do you get on Medicare if you're of the age where you're thinking about
Hmm.
what's next? If you're 65, they might say, you know what, it's time for you to go, and you have no choice in it. So you
Right.
need to have Steve's phone number so that if you do get laid off, or you're thinking about retiring, or you go into work and the door's closed because of COVID or whatever, you need facts. You need to ask questions. So
Uh-huh.
that's why Steve's phone number is very important. You
Yeah.
may not be thinking about it right now, but tomorrow it could be an emergency. And when I say
Correct.
emergency, it's not like life or death or anything, but as Steve has told us many times, if you go back and watch some of the other shows that we've done, there's penalties if you don't do certain things at certain times. So don't get caught up in that and have to pay penalties when all you had to do was call Steve, and he could give you the information that you really need.
Sure. Yeah. I'll give you a good example. Just recently, within this past month or so, in August, I had a person who was terminated. He'd worked past 65, and he needed the health insurance because he had major health issues. And he called me in a panic because he didn't know what to do. Well, they gave him his notice on the 12th of the month to be effective the very end of August. So I don't remember if what are there, 30 or 31 days in August? I don't know. 30, 31.
Um, I could tell you in a
No,
minute. There are 30 days in September, but in August, there are
31,
31.
31. Right.
31.
So he called me in a panic 2 days before his group insurance was to expire. 2 days. That's all we had. So I took down all the information, and he basically was what we call a referral. Of a person that I had worked with in the past told him to call me immediately, which he did. And fortunately, in one day, which was the following day, in one day, we were able to get a Medicare supplement set up for him and approved in one day, and to get his drug plan set up and approved for he and his wife in one day. It
And you
was a
weren't mad at them.
No, I
You
wasn't
you
mad at
took
them.
their
No.
emergency phone call. That's what I'm trying to tell people. You need to take his phone number down because one day you just might need him. 832-754-3292.
Right,
And
exactly.
and even if you're not anywhere near 65, you might have friends that are, or your parents might have friends that are, and you want somebody who's knowledgeable like Steve, who is
Right.
willing and able to take your phone call.
Uh-huh.
How many times have you used a service, Steve, and you knew that you were just bothering them?
Hmm.
They couldn't wait to get off the phone, or they couldn't, be bothered with calling you back. This happens all the time. So to have your phone number, knowing that you're going to be there at the other end of that call, to be able to help them. And another thing I really like about Steve is that you don't have to meet in person. He can get on Zoom, which is a video chat like we're doing right now, and
Hmm.
he can help you right over the video chat or on the phone. He doesn't even have to see your face if you don't want him
Right.
to.
Yeah.
Right, Steve, you can take care
Right.
of people right over the phone.
Yes. But
Now,
between the phone and Zoom, I can help almost anyone in any part of the country, wherever they are.
let me ask you, Steve, what about ID? How do I prove to you that I'm 65 and that I am who I am before you sign me up for Medicare?
Well, this may or may not come as a surprise to you, but the federal government has all the information on you. Whenever, when, you're not going to call up Medicare and say, "Well, You're telling yourself, "I'm actually 63, but I'm going to tell them I'm 65," and they go to their handy dandy little computer in there and put in your information. Da 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 da. Sir, it looks to me like you're only 63. Sorry. it's it's amazing. So
So you don't have to worry about that. They don't have to get a copy of their driver's license or anything to you.
no,
You just take down the information, you handle all the paperwork, and they're covered.
right, right. And also they know if they have your A and B, and it's an issue if someone waits past 65 but they haven't done their B yet. They're still in open enrollment. So in this particular case, the guy had major ailments, big time, and I was able to get him through because he just now applied for his B. So he hadn't had his B all of these years. So when you apply for your B, that's the same as turning 65, and people don't realize that. But
No, explain that more. I don't
well,
understand.
I tell people all the time that if you're going to continue to work and participate in their group coverage while they're at work past 65, please, please, please do not apply for your B yet. You can apply for it later, but don't apply for your B. So when it comes time that you have to have Medicare, you move into Medicare, your B is there waiting for you. And you can apply and enter at that time. And that way it's just like open enrollment. It's just like you're turning 65. I've
Didn't you
signed up
say
people way into their 60s uh, because they hadn't had their B.
didn't you say there was a penalty if you didn't sign up for your B in time?
If you're working and in group coverage, that you've had continuous coverage. In other words, you've had group coverage. So we call it credible coverage. If you've had credible coverage, then there's no issue, there's no problem. If you
Oh,
stop working and then you wait and you don't have coverage, then that is a major issue.
okay. Got it. All right. I
So,
understand.
I tell people, I appeal to people all the time. Please call me, and I'll tell you whether you need to whether you need to continue working, whether you can drop your coverage or whatever, and I can explain the differences and the issues that you've got to address right away to
Okay.
prevent major catastrophes in
All
terms
right.
of
So it's obvious. You
penalties.
just need to call Steve, okay? I
Right.
really appreciate everybody joining us for the show. It's very important that we know what's going on when it comes to our health, and as we start to get to the age where Medicare is important, feel free to give Steve a call. You can get a free copy of your Medicare and U book, which is very important. Every year the changes happen, whether we want them to or not. So
Right.
832-754-3292. Be sure and call Steve. And we're here every week. So if you have any questions or you'd like to come on the show with us to discuss Medicare issues, please let us know. We'd be happy to see you. Steve, thank you for today. You cleared up a lot of information for us. We had questions.
Thanks.
See you
Bye.
again next week. Bye.